Oh, thanks for tuning in on this Friday to the Elias Mackos Show. Second hour of the program, we will be with you straight through until noon. Little program note at 10:30 for our In Transit today. It's the return of Traffic Court. I know it's a fan favorite, so get those stories ready, and we'll do Traffic Court at 10:30. One of the big stories that we are just following this morning, we're expecting that the U.S. Supreme Court will release their ruling on Donald Trump's tariffs, right? And the legality and the mechanisms he's used to impose tariffs on so many countries. So we're expecting that ruling. These rulings come usually around 10 a.m. when the Supreme Court says they'll release them. So we have our eyes on that. Keep it locked to CJAD. When we know something, you will know something. Now we're going to start off this hour of the show with a discussion about supervised drug consumption and overdose prevention sites across this country. Now we know right here in Montreal, it has caused controversy. I've heard from people that live near such sites in St. Henry. Their lives have been affected. There's a new study out from McGill University researchers, and they're taking a look at the safety in and around these safe consumption sites. Do they make communities less safe, more safe? I know everyone's trying to get to the bottom of that answer. Let's go to Dimitra Panagiotoglou, an associate professor at McGill University, lead author on this study. Dimitra, welcome to the program.
Hi, thank you for having me.
Take me down the path of why you decided to look at this.
Sure. So back in, I believe it was August 2024, the provincial government of Ontario was looking to shut down many of these sites and or possibly convert them to what we now call heart hubs. And one of the motivations behind that was concerns around safety. So we wanted to get an idea of how much safety had changed near these sites, and ideally across the country. What we ended up doing was focusing on Toronto because when we looked at publicly available data, which was what we were hoping to use, the Toronto Police Services really had the gold standard there. And so we focused on crimes based on what's reported in the Toronto Police Services database within 400 meters of each of 9 sites that were implemented between 2017 and 2018 in Toronto.
So I've seen some headlines here connected to your study. Okay, let me just read you a couple of headlines I've seen in Canadian media. Supervised consumption sites aren't linked to increased crime. And here's another one. No link between supervised consumption sites and crime rates. Those headlines accurately describe what you found?
No, unfortunately, I think there's more to the conversation than headlines tend to have. So if we're going with like a summary of the high-level statistics that we looked at, then across the board, there was no consistent evidence of increases in crime. However, for anyone who's curious and wants to read the paper, which is publicly available, we do notice that there's an immediate increase in break and enters, about 50%. So that outcome is very consistent across multiple sites. And then specific to some communities, so for example, South Riverdale, we do see that over time, there tends to be a trend in increases in assaults, for example. So it's very contextual. It's not to say that there was no crime increase across the board.
So, Dimitra, isn't that incredible? Like the two headlines I read you, and then you just told me break-ins up 50%, and the other one that you just said, the assaults, right? Also up. I mean, like, my goodness, is that, that's astounding about the difference between headlines and what you just told me here.
So that's kind of what's been an issue with these conversations for the past week. I think people are looking for a simple explanation, and unfortunately our work doesn't do that. It just kind of summarizes what we can find across the board.
Gotcha. So now, let's go to the alternative here. Is there any evidence where, some types of crime have gone down or things have gotten better?
Yeah. So I'm scrolling through. I think the one that really surprised us initially was bike theft. Which you think of are really opportunistic, so there'd be an easy one to see a spike in, and it didn't materialize. And then, for example, robberies within 400 meters over time went down, which was also surprising. So there were examples where it went down, and there were some communities where there wasn't an initial spike to begin with. I think Parkdale stands out for several of its outcomes. And so what I want people to take away from this isn't that we're saying one or the other. It's that we need to dig deeper and to understand where it works and why it works, as well as where it didn't work, what was going on there.
We're with Dimitra Panagiotoglou, an associate professor at McGill University, lead author of a study that looked at safe consumption sites and overdose prevention sites in Toronto, in the Toronto area. And so, Dimitra, I want to ask you, because, I have discussions all the time. Mm-hmm. I go to dinner parties, I'm at parties, and I still recall last year I was at a dinner party, and it was couple after couple, and they all had kids. They had one or two children, couple after couple. Mm-hmm. And some of them lived in St. Henry of Montreal, near that Benoit Labre site. Mm-hmm. And it was just unanimous. And they were just telling me, Elias, things are getting worse. They see it every day. They see the needles. They don't walk with their kids in the park. And I'm trying to get to, sometimes I feel we have studies, and then we have what people are seeing and feeling with their, they feel with their emotion, they see it with their eyes, and it seems like a disconnect. How do you grapple with that when you do studies like this?
Yeah, absolutely. I mean, first of all, a clear limitation of this work was that we weren't able to look at those other indicators of how safe people feel in the community. The data just wasn't high quality enough for us to work without it being concerned of being biased. But I agree that we didn't look at needle and syringe discardments. We didn't look at public defecation, what is often grouped as nuisance, but really does lend to how comfortable you feel just moving through your own community. And I want to echo that. I also have young children, and I have seen over time that there is more public displays of drug use, homelessness, and clearly people having high needs like episodic events in terms of mental health crises, et cetera. And so I'm not discrediting those feelings.
But
it's kind of been scattered across, and you see it around encampments as well. So I don't think it's truly just the supervised consumption sites, but rather these clusters of people who have very little else to support them with.
What do you think people should be taking away from your study?
Yeah, so I think there's obviously more to be done here. I would be curious to see what the heart hubs in Ontario have done, because they've transitioned from supervised consumption to really pushing for access to treatment. But I also want, in cases like Montreal or other parts of the country that are looking at the sites that they currently have, understanding where it is working and where it's not, and working with the communities to strengthen, one, their engagement, regular conversations, true conversations, and efforts to improve the quality of the communities. Because I feel without public support, none of these harm reduction interventions and efforts to improve the drug crisis overall are sustainable.
What do you think should be focus of further study? What do you think you and other researchers should be looking at if we want to get down to true evidence here of if these sites are a positive or a negative for society?
Yeah, so specific to Montreal, I'd be happy to work with police sources, because I imagine they are collecting the data. They're just not having it on a readily available platform that researchers like I can use to understand, is what we're seeing in this Toronto study be replicated in Montreal? Is there something different going on here across the sites that we have here? I'd also like to be able to do more about the public nuisance angle and look at it across the city as well as concentrated around these sites. So there is room for lots of people to get engaged and work in this space, for sure.
Do you think that police transparency or other government body transparency is standing in the way of that type of research here?
No, I don't think so. I hope not. I think it behooves us all to be as transparent as possible, which is why we worked with the kind of data that we did and made it a publicly available paper. Because I don't think hiding or trying to gloss over the nitty-gritty details is serving anyone in the long run.
Dimitra, great discussion. I want to thank you so much for coming on and providing us, I think, with some really good insight to your work. I appreciate it.
Thank you for having me.
That's Dimitra Panagiotoglou, an associate professor at McGill University and lead author of this study that looked at safe consumption sites. When we return, we're actually going to keep this conversation going. We're going to speak to Derek Finkle. He's an investigative journalist who has looked at these types of sites, supervised consumption, overdose sites. And we're going to talk a little bit more about the effect of these sites on cities across the country. Let's do that next.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years. And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.
Welcome back to the Elias Macko Show, and just a little note here as we've been following the anticipation that perhaps the U.S. Supreme Court was going to rule on Donald Trump's tariffs. What we found out earlier in the week is that today was going to be an opinion day where we would get rulings. Many people thought that meant that the tariff ruling was going to come today because it had been a while, but lo and behold, the Supreme Court only coming down with one opinion today, and it's not the tariff one. So they're still punting that one, and that will come at a later date. So no ruling on the tariffs going to come today from the U.S. Supreme Court. Let's continue our discussion now on supervised, so-called safe consumption sites in this country. Drug use we're talking about, of course. Of course, in this city, we've seen some contentious debates. I'm thinking of the site at Benoit Labre near a school where residents in the area have said things have deteriorated over the last little while. We were just speaking to a researcher from McGill University that looked at safety around these sites. Let's keep this conversation going with Derek Finkle. He's an investigative journalist who has looked at this issue for many years. Derek, welcome to the program.
Good to be with you, Elias.
And I think you were listening to our interview with our McGill University researcher, right?
Yeah, and I've heard a few other interviews she's given recently as well.
So why don't I just get a bit of your reaction here? Like, to me, I was happy to hear that some of the headlines I've seen in the media weren't necessarily accurate. Because again, I looked at some of the headlines like, "Oh, these sites are amazing. There's no connection between them and crime," and that wasn't necessarily the case as we just heard. So, what's your reaction?
Well, I think the headlines were the point of the study, which is perhaps something we can get to later. But first, I'll just say, as someone who's lived across the street from an injection site for 7 years, the South Riverdale site, which your guest just mentioned, and as someone who's written about 50,000 words about injection sites over the last 2.5 years, I have three major problems with this study. And perhaps I can just quickly articulate those, and then we can move from there, okay? So my first problem with this study is that it focuses on crimes that people were charged with. She referred to major crime indicators like break and enter, assault, bike theft was one she mentioned. And the reason why this study focuses on crimes is that a woman was shot and killed in front of the injection site in my neighborhood on July 7th, 2023 by 3 drug dealers who were involved in an altercation. The trial for the murder trial for one of those drug dealers just concluded a few days before Christmas, and he was found guilty of second-degree murder. And one of the things that was revealed in that trial, the jury was shown hours and hours of video of what went on in front of that injection site. Both sides called it an open-air drug market. At one point in time, there were 6 drug dealers. A few seconds before the shooting, there were 6 identified drug dealers within a 15-foot radius in front of that site. The 3 drug dealers involved in the altercation were not from our neighborhood. They didn't pre-exist here. They were commuting about 12 kilometers every day for many months to come and deal drugs in front of that site. There was an expert witness in drug trafficking who appeared at the trial, and he testified that these injection sites are fishing holes for drug dealers that draw them from far and wide. Gun violence is what got our community's concerns finally addressed, but gun violence was not what we were expressing concerns about, only to be ignored for many years by the site. Our concerns in descending order were, number 1, open drug use. Number 2, drug dealing. Number 3, discarded needles around the perimeter of the site and in the 2 elementary schools and 6 daycare facilities that exist within 150 meters of the site. Number 4 was lewd behavior that children were witnessing to and from their way to school. And number 5 was threatening behavior, which sometimes crossed over to assault. Now, only one of those 5 things is actually a prosecutable crime in Toronto, and that's assault. So more than 90% of the things we were complaining about are not crimes in 2025, 2026. My second problem with this study is that your guest kind of glossed over one finding of her own study, which was that within 100 meters of the sites once they opened, there were increases in assaults of 61%, robberies 62%, and break-and-enters 47%. Now, the study claims that these these numbers slowly lowered over time. And the study posits a number of theories about why that was. One of the theories was that policing actually improved, which is a joke. In my neighborhood, we found out after the shooting that our neighborhood's called Leslieville. There's 30,000 people in it, downtown East Side Toronto. We did not have any dedicated community police officers in our community of 30,000 people with an injection site, which is incredible. And the theories that this study, the real theories why the crime rates went down, aren't even addressed in this study. One is that around the time the crime rates started to go down, the Toronto Police Force started to adopt a de facto decriminalization policy. So there was no arrest for open drug use, there was no arrest for small quantity possession, and there were no arrests for low-level street drug dealing.
So if you're not arresting, it's going to be hard for the stats to show an increase in crime.
Exactly. Yeah. And to make it even worse, around the same time, 2019, our site and all the other sites in Toronto began to adopt what was called a non-enforcement a non-enforcement boundary around the site, which basically meant they didn't want police around the site because it would inhibit people from accessing the services. And in fact, right around in 2019, we had an incident that my neighbor witnessed where a plainclothes police officer tried to arrest a drug dealer outside the site, and 2 employees from the injection site came running outside to intervene to stop the arrest. And after the shooting, the supervisor of our precinct told us that the relationship between the police and the site was terrible. It was acrimonious. They did not get along. So that has something to do with it as well. And my third and final point is that this, as I said before, this study focuses on crime data, publicly available crime data. And one of the things we learned after the shooting, the police, when they finally started addressing our concerns after years of doing nothing, they put us in touch with Toronto Police Service data crime analysts. And one of the things we learned from them was that this publicly available data that this study is based on is not the gold standard, as your guest just said, for compiling data about what goes on around injection sites. The way to do it is by calls for service, because the police can geolocate where somebody's calling from much more precisely than they can with this data, because where someone gets arrested is not necessarily where a crime occurred.
Gotcha.
And so one of the things we learned in our neighborhood, for example, was that in the warmer summer months, when open drug use and all these other things become more problematic, it's not a problem in the middle of February in Montreal and Toronto. Our calls for service for priority 1 and priority 2 911 calls, and within 200 meters of the site, went up by between 700 and 900%. And in your own city, you just mentioned the St. Henri.
Yeah.
There is lots of data. I'm actually shocked that your guest is not aware of any of the data for the St. Henri. Sorry, I keep calling it St. Henri. I don't know.
That's okay. Henri. English, French, it all works. Don't worry.
Okay. So the St. Henri neighborhood, one of the neighbors of that site is a gentleman you may have heard of. His name's Dr. Michael McKenzie. He's the professor of social work and pediatrics at McGill University, the same university that your guest works at. And he's the Canada Research Chair in Child and Wellbeing. Their neighborhood compiled with the police very concrete data based on where the calls for service come from. And I won't get into it all because we don't have time, but I'll just read you one sentence from Dr. McKenzie, okay? SPVM data showed out to 250 meters from the center. This is after the site opened in April of 2024, just so we're clear. Showed out to 250 meters from the center. Mischief calls increased by 800%, a 93% increase in crimes against people. Even overdose incidents were up 300%, giving lie to the claims from Maison Benoit Labre that they went to where the need was already existing and are preventing overdoses in the area.
Derek, I have about 90 seconds left here with you, okay? One of the things you started with off the top is that you intimated that the reason for some of this research is to try and get headlines that will tell the public everything's fine here. So why don't you touch upon that? What are you seeing when people do research this subject in this country? Are they stacking the deck to get one result?
They absolutely are. This study is one of several studies, and I'm going to write about this in a future column, that is essentially a crisis management response to what happened. And there's a macro response, which your previous guest was part of, and there was a micro response right after the shooting, for example. Within an hour of the shooting, all of the staff at the injection site, this came out at the trial also, they got together and management said, we need to control the narrative. We need to control the narrative. And there were a number of studies. There was also a study done about, is there a connection between homicides and injection sites? And that all got blown apart by another professor at McGill who said that community level homicides are such low level crimes that you can't actually extrapolate any meaningful data from them. And this study is the same thing. They know that the problems with injection sites aren't crime. It's not. She mentioned bicycle theft. Like, that is a joke. That is actually offensive to me. That we are talking, a woman got shot by drug dealers. Nowhere in this study does drug dealing even enter the fray. And so this is basically a form, to me, of academic gaslighting, and it's nothing else. And I'm sorry if that seems a bit direct, but that's how I feel about it.
Well, so Derek, like, I'll say this, like, in all the discussions, and I should also point out, like, I used to live in downtown Montreal, moved just over 2 years ago, because I was seeing it with my own eyes. And every time these sites open, the people that live in apartment buildings and condos near the site, they say, well, now I can't even walk up my staircase. Like, at a certain point, like, I've always been, and this has been the sort of the theme of the show now increasingly, is like, we have to listen to what people say and what they see with their eyes, and stop looking at studies that want to refute what we all see with our eyes. Derek,
I would encourage you to get Dr. Michael McKenzie on your show one of these days. He's a professor at McGill.
Derek, we'll follow that lead, and I really appreciate your time and your insight here, okay?
Thank you.
Derek Finkle is an investigative journalist. He's covered these safe consumption sites for quite some time. All right, we have to leave it there on that subject. I think we had a good half-hour discussion on it. When we return on this show, it's in transit for a Friday, and we'll head to traffic court and your cases coming up next.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian owned and operated. Charm has been part of your love stories and bromances for over 50 years.
And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.